We are joined by Dr. Stephen Glazer, the president of the Canadian Association of Bariatric Physicians and Surgeons. Doctor, welcome to the show.
Thank you for having me.
So how has the pandemic affected patients with obesity?
Well, when we look back on previous pandemics, we do know that people with obesity, in particular severe obesity, are at increased risk, as you mentioned, of hospitalization, ICU admissions, and fatalities. From COVID-19, we now become aware that advancing age, diabetes, cardiovascular disease, respiratory disease are risk factors. But obesity is an independent risk factor for susceptibility to disease, severity of disease, and death. And meta-analysis of over 400,000 infected patients looked at patients who were obese. They had 113% higher likelihood to be hospitalized, 74% more likely to be admitted to the ICU, and a 48% higher likelihood of dying.
And what do we know so far about how the virus specifically affects patients with obesity in the body versus those who meet the criteria for a healthy body weight?
Well, obesity by definition is the deposition of fat cells in organs leading to dysfunction. So there's conclusive evidence that obesity is causally related to things like hypertension, diabetes, coronary artery disease. Those are risk factors for COVID in and of itself. But people with obesity have problems with insulin. They have problems with exaggerated inflammatory responses. They have dampened immune responses. They have problems with lung function, which makes ventilation harder. They have a higher tendency for blood clots. Some may be malnourished. And all of that sort of factors into a worse prognosis.
So do those factors also make these patients more vulnerable to other viruses?
Well, it is true that obesity has been associated with impaired immune responses, not only to viruses, but to bacterial infections as well. And that may be due to changes in the cells of adipocytes that are responsible for more aggressive damage and worse prognosis.
All right, Dr. Glazer, we've got 2 vaccines circulating the country at this moment, and there is concern around vaccine hesitancy. What do we know so far about vaccine hesitancy among obesity patients?
Well, it's very interesting. So when we look at vaccine hesitancy, we have to really break it down into what constitutes hesitancy. So a person has to have confidence that the vaccine is going to work. They have to be aware of the perceived risk of receiving a vaccine, their comfort level in receiving it for themselves or their children, and that's balanced with their actual fear of the COVID vaccine. And all of that works together in determining whether a person would be hesitant or not.
And how do the current COVID-19 vaccines affect patients with obesity so far?
Well, if we look at the Pfizer study in particular, I'm very happy at the fact that about 35% of the participants were living with obesity. And they seem to fare exactly the same as the general population, which is very good news for us.
All right, Dr. Glazer, we've got about a minute and 30 seconds left, but what do we know so far about how vaccines in general affect patients with obesity?
Well, we have, through observations, shown that obesity may be linked to lower vaccine responsiveness. We've seen this with hepatitis B vaccine, tetanus, even influenza. So an individual who's obese that has an influenza vaccine is still at increased risk of getting infection. Even with H1N1, we saw that people living with obesity had lower responses than the general population.
All right, Dr. Glazer, a little over a minute left, but what needs to be done to ensure patients with obesity are safe from this virus?
Well, I think we need to recognize that in Canada and in the adult population, about 34% of the adult population is living with being overweight, and 26%, or 8.3 million, are living with obesity. So it's a real problem. We need to recognize the association between COVID and obesity. That is a significant risk. I think we need to develop a couple of strategies. One, we really need to understand that weight loss, and even a little bit of weight loss, can be associated with positive health outcomes. And then we need to have an aggressive public health strategy aimed at education, and education on the risk of infection, how to prevent the infection. But also, we need to address vaccine hesitancy, and we need to advocate for those who can have a vaccine should get it.
All right, Dr. Glazer, thank you again for your time today on our show.
Thank you, and be safe.